Coming up now then in the speaker studio, I'm joined by Rachel Power, Chief Executive of the Patients Association. Now, Rachel joined the Patients Association as Chief Exec in 2017 and has led changes in the charity, resulting in a more engaged membership and an increase in profile for the Patients Association, and its goal of embedding patient partnership in the design and delivery of healthcare services. Rachel, welcome to the studio.
Thank you so much for having me.
And another one of our speakers have joined us, and you were speaking yesterday and you've got sessions today. Let's start with yesterday. How was day one of the NHS Confed conference for you?
Day one was really, really good. The Patient Association is delighted to be here because the role that we bring to it is to make sure that we remain focused on that partnership with patients, because we've done quite a lot of work with patients around a variety of different topics, and we have a free phone helpline. So patients ring us Monday to Friday, so all the information I hear on there I bring to these conversations. So yesterday we talked a lot about digital, we talked a lot about the NHS app and the benefit that the NHS app can bring to patients, but also talking about the fact that there are people for whom digital still won't work, and we need to remember about cost of living crisis in the country, people who aren't digitally connected, and what we can do to make sure that we don't leave those people behind.
That's interesting, because I work personally with a charity who covers sort of digital inclusion or digital exclusion, trying to end digital poverty. Is that quite a big issue you find, like within the UK?
Well, I think there are stats out there that I don't have to hand of that are quite large around people who don't have Wi-Fi access in their home. But we also have to think about health inequalities and English as second language, and also remembering that health literacy in the country is between kind of 9 and 11 years old. So we really need to work to make sure that those people become included and that patients can still receive services in a way that works for them, that it doesn't always have to be digital, but totally recognizing how the benefits of digital as we develop the NHS and health and care services. So we've done, as an organisation, we've done a lot of work where we've done work with community connectors who are working in communities to help communities to become more digitally savvy and to be able to access the app.
Okay, and in terms of your obviously supporting digitally engaged citizens, like if people were to tune in, because yesterday's sessions will be available on catch up soon at some point, what do you think the main sort of takeaways from that session would be?
So the main takeaways from that session would be, I think what I've just said is to make sure that we bring people with us, that NHS England and the government make sure that they do a lot to communicate how the app works, but also working with healthcare professionals to make sure that they embrace the app with patients, because we hear sometimes that patients struggle to get access to their medical records and really want access to their medical records, and everyone on the panel yesterday were completely understanding that patient records belong to the patient. So that was really, really important, and I think we brought that then into the second session that I did yesterday, which was the role of data in making sure that we can really have true patient partnership in the design and delivery of services, but also in individual consultations, that role of shared decision making.
Okay, and tell us a bit more about what you sort of want people to take away from the digital and the data session, like what the sort of things you want people to learn, key points, key learnings from that session.
I think the key learnings from that session is about making sure that we understand the needs of the communities that we're working with, that we make sure that that as we develop more detail into the NHS app, that we really make sure that we understand what patients want on the NHS app, and how it'll work for them.
And how are you sort of gaining that information? Because I was speaking to people yesterday in the studio, and they were saying that they were developing a product that they thought patients wanted. This is what we think they want, and they sort of nearly got so far, and they started having a conversation. It wasn't what they wanted at all. They were like, no, we don't want that, we want this. So they totally went back to the drawing board. Strategically and from a development perspective, is that your goal? Is it gain the information first before we start developing sort of products
Yeah.
and systems?
So, it's about totally starting with patients.
Yeah.
And like anything that you'll design, you start with the people who are going to use it and then test it with them as it goes on. And, I'm smiling because I hear that so often, that I hear from people developing products and they're like, well, I spoke to somebody down the road. And you're like, well, that's not really. So one of the roles that the Patient Association plays is we often support organisations in finding cohorts of patients and diverse cohorts of patients so that they can really work with them and do some focus group work or survey to really understand what's important, and then take those recommendations and use that as the starting point.
Okay. So they get it right first time rather than
Absolutely.
making
And
products
we
go back.
just finished a piece of work on so there is that strategy out there called Data Saves Lives, and we just finished a piece of work on the data pact, the promise between patients and the system as to what will happen with their data. And, we managed to convince people that we started with a blank sheet of paper and went to patients and said, actually, what's important to you about data?
Okay.
What do you want to understand when your data is being used? And that's worked out. It's now part of a bigger piece of work. But if you start there, you understand what the positives are, what the concerns are, and if you can understand the real concerns at the beginning, then you address them as you develop a strategy or a product or
Were there many surprises when you did start sort of delving into it? Like, because I think a lot of companies and people, you think you kind of know what people want. Were there any sort of big surprises or challenges maybe that flagged up from what the feedback was?
Not big surprises, but I suppose time and time again, what partners that work with us realize the benefit of actually starting with patients.
Yeah.
And understanding that sometimes it's not something to be scared of. Patients are going to come up with good solutions.
Yeah.
And it's not that, you have to take on everything you hear if it's not possible to do it. But I think what they realize is that kind of partnership. The system needs to work with patients to develop every service, because, it means the product or the service will work better, it'll be safer, it'll be more efficient because it's working for the people that need to use it. And that must be really good for people who are developing services and products as well. It must be really motivational to go, this is what they want and this is what we've done.
Absolutely. And I think from the research you've done and the sort of feedback you've got and knowing what people want, is there any sort of products or services that maybe people don't know about that you've gone, actually that's really delivering on what the sort of patients require, what their needs are? Have you seen any sort of standout products or systems?
It's hard to pick out any product or system, and I probably shouldn't pick out because I don't know. We're a very small organisation,
yes.
So there's quite a lot that we won't know about. But I suppose one of the things we hear regularly from patients is about communication.
Okay.
And it's a regular theme on our website, on our helpline, through our focus group, through any of the project work we do. So, and it's about communication not being as genuine as it could be.
Okay.
And so what we know that whatever you're developing, your communication with patients needs to be better in most cases. But also there needs to be a level of transparency about why and how that's going to work. And so one of the things that we're looking at is how do we help systems achieve that genuine two-way communication, recognizing that we do have a lot of health inequalities in this country, and we need to think about how we communicate with different communities.
Brilliant. Rachel, it's been very insightful. I'd say it's nice to see, really putting patients first, like you say, getting that insight. So I really appreciate you sharing your knowledge and wisdom with us today.
Thank you for having me.
Pleasure. That was Rachel Power, Chief Exec of the Patients Association.